Namaskar and welcome to Health Hour by Apollo 24/7 Experts. Every Sunday, we bring you experts from Apollo hospitals so that you can ask them your questions and queries on this live show. Join us on the live show if you want to ask a question. Today, we are going to talk about why cancer cases are on a rise and everything about cancer. You have a question, join us on YouTube where you can type your question in the chat box. I shall take up the questions with the experts who are going to join us very soon. You might be watching this on Apollo 24/7 and other Facebook pages as well. But if you want your question to be answered, join us on the YouTube chat. All right, so today we also have a health quiz. You can win gift vouchers and prizes from Apollo 24/7. Also, we are going to give away gift vouchers towards the end of the show. Please stay with us till the end of the show. चलिए आज के टॉपिक के बारे में बात करते हैं. हाल ही में कल हमने मनाया है वर्ल्ड कैंसर अवेयरनेस डे. तो इसी मौके we are going to talk about why are cancer cases on a rise and how can we help people. And it is wonderful. We are going to have three guests today, two experts from Apollo Hospital and also somebody who's beat cancer and who's been victorious also will join us for a brief moment. चलिए आज के experts को हम introduce करवा देते हैं. First on the show, I'm going to invite Dr. Kumar Rishikesh, who is a medical oncologist from Apollo Hospitals, Indraprastha, New Delhi. Dr. Saab, namaskar, welcome to the show.
Namaskar, my name is Dr. Kumar Rishikesh. Thank you, Ms. Jansi, for inviting me and giving me this opportunity to discuss.
Wonderful, sir. We'll have a great discussion today. And also joining us is Dr. Anil Kamath, who is a surgical oncologist from Apollo Hospitals, Bannerghatta Road, Bangalore. Namaskaram, sir. Welcome to the show. Sir, I can't hear you well. I hope you're not mute. You have not pressed the mute button. Yes, sir. I can hear you.
Thank you. Thank you for inviting me.
Yes,
it's a pleasure.
Thank you so much. Thank you, sir. So, Ms. Anchal Sharma, who's an activist who's working towards awareness of cancer, will join us very shortly. In the meanwhile, let's talk to our experts, Dr. Anil Kamath and Dr. Rishikesh Jha. Good morning, sir, once again. As we have celebrated World Cancer Day, it is really alarming to understand there's an AIMS report that I was reading just now, that India is going to see a surge of up to 20 lakh cases of cancer per year by 2016. Is this alarming, or people, while you were there in the field of cancer treating and giving out help to people, are you also seeing that the surge is a trend? Dr. Anil Kamath, would you want to go first?
Yes, definitely the number of cancer cases are on the rise. There is no doubt about that. Not just the figures from India, the figures from all across the globe show increase in number of cancer cases. Now, why is this happening? So, I would classify into probably three reasons. One, the simplest reason, that people are living longer. If you just see our life expectancy in India, it has almost doubled in the last 40-50 years or so. And cancer is essentially a disease of old age. So as people live longer, there will be more number of cancer cases. And also because many people are surviving cancer, we might see that the number of cancer cases, those who have been treated, is also on the rise. That is point number one. The second reason is better detection. This I would attribute has been a very important reason for seeing an increased number of cancer cases. The diagnostic facilities like the FNAC or even the other tests, which were difficult to get earlier, now are easily available. Even the smaller cities, even villages now have these facilities to diagnose cancer. So that is the second reason why we are seeing increased number of cancer cases. And third and most importantly, the first two reasons probably we can't do much about it, but the third important reason is the lifestyle that we follow. Cancer is a lifestyle disease, so whatever the cancer develops, most of it is related to the lifestyle we follow, whether it is smoking, tobacco consumption, or obesity, or the pollution that we face. So this is the third reason. So all three reasons put together, the increased lifespan, better diagnostics, and third, the lifestyle that we follow, all have contributed to increased number of cancer cases.
Dr. Kumar Rishikesh, I would want you to first start off with, telling us what cancer is from the basic level for our audience to understand. I see today audience are buzzing with questions. Our chat box is already filled with more than 50 questions there. So I'll start the questions in a while, but let me understand what a cancer is and what can it do to us.
Okay, thanks for asking this. So, human body is like repairing itself continuously. So we have newer cells coming up everywhere, and mostly the linings were like in breast, where the milk is formed, in the intestine, where you have a absorptive area which takes up the nutrients. So similarly, in all the dividing areas where the cells are dividing, there's propensity of error. So if the cells are dividing, there may be error. So if there is error and those error cannot be rectified by our immune system, those cells, abnormal cells, if not killed, they go into autopilot mode and they divide itself incessantly, and because of this uncontrolled growth, you have the tumor mass. Similarly, it happens in the blood cells. If there's undividing cells, dividing cells which are uncontrolled, you have blood cancer. Similarly, if there's undividing cells which are abnormal, and those cells are abnormal, this is very important to understand, because they are abnormal, but they still need nutrition. So they take over our immune system, they take over our nutritional supply, and then they are become dominant things in our body, and rest of the body is neglected by the whole thing, the whole system which has been generated by the cancer. So this happens. There is a system where something has come up which was not supposed to be there, but now this has taken over every other system and is dominating. So rest of the body get definitely less nutrition supply. They lost. I mean, we lose body weight. We have, I mean, poor control over everything, and patient culminates into ultimately death. So this is the important thing to understand, that cancer is basically uncontrolled, unregulated growth of our own cells.
Right. So, Dr. Anil, they must be earlier, they used to be this bhoot hota tha ki cancer hai, so it's the end of life. Now we see so many stories that people have beaten cancer, they've been victorious and they're living their life. So, you are able to, with the technology and the medical advancements, you people are able to give us some kind of hope. So, what are the
Yes.
latest? Are we still holding that kind of fear towards cancer, or are we much better than what we were earlier?
We are much better, but it would be wrong to tell that that fear has totally gone off.
Correct.
And as a doctor, it's not that that fear is totally wrong also. We do see cancer patients suffering. We do see cancer patients who have taken treatment properly. They have taken whatever the doctor has advised, and yet they have got a recurrence. So these patients start worrying. What is that we have done wrong? We have followed whatever the doctors have told us. So this sort of feeling is there. But when we take the majority number of patients, the survival of cancer has definitely improved. We have more choices now, and more and more patients are getting cured, and even those who are not getting cured, say even a stage 4 lung cancer, which had very little options earlier, now there are quite a few options, and these patients, even though they can't be cured, they can be treated and they can survive many years. So all these developments are happening. Of course, there is a subset of patients who cannot be cured and who go into this advanced care, but that is not the rule. The rule now is that
Yeah.
most of them can be treated effectively with very little maintaining their quality of life. So that is what we
Wonderful.
are looking at. Yeah.
Yes, I think Dr. Kumar Rishikesh is having trouble with the network. Sir, can you hear me, Dr. Kumar Rishikesh?
Yes, yes.
Yes. So, as Dr. Anil Kamath had already mentioned, ki right treatment is important, and also early detection also plays a very, very important role. There are a few questions that I would want to take up from the audience quickly before I ask my question. This is Baneet, Pratik, and Arvind. All of them are asking similar question. Ki what are the screening tests and when should one get done? Any screening tests and who should get done?
Okay. So I will divide this in male and female. So there are separate tests which are pertinent for male and for female. And then again, there are certain things which are common. So the first thing for female would be to start is the pap smear for cervical cancer. The cervical cancer is one of the very common cancer in India, especially in the rural setup. It's very common, though it was number one. Now it's gradually going down, and the breast cancer is coming up as the second. So fortunately, we have very good, and we can say that confidently that very good, and it has shown its result over the years, that the cervical cancer screening in the form of pap smear. So pap smear is usually advised to begin at the age of 25, and it should go till 65. Usually, I mean, it's recommended that if you are doing HPV DNA, that's the virus which is basically the cause for the cervical cancer. So you are doing a very simple test, taking cells without any needle, without any biopsy, just a brush. It takes the sample from the cervix, that is lower part of the uterus, and we test whether there is abnormal changes going on in those cells. If we have any changes, we take further actions. So understand this, that this you are, if you are having abnormal pap smear, it doesn't mean that you have cancer. It's just that we have something going on which can culminate into the cancer. So pap smear is done every 3 years if you are doing only cellular testing. If you are doing DNA testing, then every 5 years. So every 5 years one test, and believe me, it will prevent development of any cancer in the cervix. If you add it with HPV vaccination, the age group is 9 to 12 and can be extended to 17 years. So, fortunately, we have this vaccine also for cervical cancer.
सर्वाइकल
So,
कैंसर.
together,
बट जिसके बारे
together,
में इतना हमने अवेयरनेस स्प्रेड नहीं किया है, अभी भी लोग वैक्सीन के मामले में हिचकाते हैं और डरते हैं, that they've not come forward as much. I hope it changes in the future generations, and we give one vaccine to prevent at least one cancer that we have.
okay. I mean, taking further, the one is cervical cancer. Second cancer, which we can prevent from developing, or early detection, which can save lives, is the breast cancer among women. So the breast cancer screening should begin at 40 years of age, and if not, then at least 45 years of age. Those that are having family history of breast cancer, they should start screening earlier. So these are the two cancers specifically in the women. And the third thing, like in male, the prostate cancer, we can start screening at the age of 50 by the PSA testing, simple PSA blood test, and digital rectal examination. Other than that, the colon cancer screening is also available, which has shown its result, though there is now fewer studies coming up that it may not be very effective to save lives. But however, we have at least 4 to 5 cancers which can be saved or detected early to save lives.
Right. So, understanding that early detection is important, and how important is it to have understanding of family history? Dr. Anil Kamath, would you want to add here? Who's prone more, other than the environmental and the lifestyle choices or the reasons? What else can cause cancer?
Yeah, you were talking about the familial history. There are two things. Any cancer, there is something within us and something from outside. So when we talk of the genetic defect or the inherited defect, it is within us. So let me talk a little more about familial cancer, since there is much better understanding of these type of cancers now as compared to a few 1 or 2 decades back. The best studied is breast cancer. About somewhere about 5 to 10% of breast cancers are hereditary. So you will get certain families where the breast cancer incidence is more. And now we have the facility to test it. So basically, when a patient comes to me, she says, usually the typical scenario is that it's a young lady, say in her early 30s or much below what the normal population is. And when we take a history, she says either her mother had breast cancer or her mother's sister had breast cancer. So when this is this one, we have facilities to test for the genes of this lady. The regular one which we do is called the BRCA gene. So now the test is easily available also, and I am seeing in our practice more and more patients that we do. The number of patients in whom these genes are coming positive is also on the rise. So
Yes.
we are seeing more patients who are BRCA positive, and in these patients we are in a position to offer them some treatment also, either in terms of this one prevention using medicines, or in terms of certain surgeries. So the familial cancer, this is best studied in breast. Even colon cancer, we are finding more and more patients in whom we can do genetic tests and see that these genes are positive. So these are
So
the
my
things.
Yeah,
Yeah, please go
my
ahead.
question here in continuation with your advice. So, is it particular cancer which runs, or any cancer can lead to any other cancer? What is it like? If somebody has a history of breast cancer, that means that genetically उनका बस breast cancer ही pass on होता है, या कोई और cancer भी pass on हो सकता है?
कोई कैंसर हो सकता है. BRCA gene is not just associated with the breast cancer. It is associated with a whole set of other cancers also, especially cancer of the ovary and the endometrium, and certain other types of cancers are associated with these. And you should remember, it's not just the females. The mother might have breast cancer and the genes can pass on to the son also, and he will be susceptible to a whole lot of other cancers. So it is not
Oh.
just breast cancer; it can be any other
So it's
this thing.
important to understand what our forefathers or grandparents or how our lineage is coming from, and to be aware of cancer is more important. Right. Dr.
Yes.
Kumar, here's a question from our audience. Abhishek Palit and Deepak Patel, both of them are asking about prostate cancer. Abhishek Palit's father-in-law is suffering from prostate cancer. Any precautionary measure once cancer is there, I'm not sure, but maybe he's asking about the treatments. And Deepak Patel is asking about early signs of prostate cancer.
So good question from Abhishek and Deepak. And prostate cancer among male is very important. And though it's a slow growing cancer, but इसमें जो sufferings है और treatment है या फिर outcome है वो सब का एक combination को समझना बहुत ज़रूरी है. So for prostate cancer, the best thing is still that if you are under follow-up for some reason, like somebody having a large size of prostate, and he is going to his urologist frequently, taking medicines and other things. So these kind of patients are usually detected early. But somebody, does not have this kind of symptom, then we may find the disease at advanced stage. So the guideline is for, the person, male person, to start screening for the prostate cancer at the age of 50 or earlier if there is a family history, or
Okay.
the genetic mutation, as Dr. Anil Kamath had just mentioned, that if there is genetic history, if there is any proven test positive like BRCA mutation, then we have to start screening earlier. So prostate cancer is one of the things which can give you good result if you detect it early. Unfortunately, if it detected in later part of life, later point of time when the disease is already advanced, then also the outcome is good because, if I compare it with other cancers, because a lot of medicines are now available and patients usually do good even in the advanced stage prostate cancer. So the treatments have evolved, fast changing treatment in the prostate cancer. A lot of researches are being done. And other than surgery, radiation, chemotherapy, hormonal therapy, and immunotherapy has taken a very advanced role in this type of cancers.
Right. Dr. Anil, one of you, please guide me who has to answer this question. Ajay Kumar is asking this question for a 70-year-old female suffering from colorectal cancer, going for a robotic surgery. Please advise the consequences. Also, colorectal cancer ke bare mein, Saurav Kumar Tripathi is asking, I'm diagnosed with IBD and there's a recurrent pain in the lower back. Should I go and test for a colon or a rectal cancer?
Yes, let me take those questions. I think being a
Yes.
surgeon, I might be able to
Yes,
answer it a
doctor.
little better. Regarding the first question,
Ajay Kumar.
yes,
Yeah, the
his
70-year-old
question was,
female.
yeah, I would not like to comment specifically on this one because we have to know more medical detail. But by and large, robotic surgery is something which, especially in colorectal cancers, has come up in a big way, and it has many advantages over the regular surgery. So the regular surgery earlier used to be open. This, though what we do inside is the same, that I must tell, whether it is open, laparoscopic or robotic. But when especially elderly lady is saved a long incision, the pain will be much lesser. And when the pain is much lesser, we see that within the first day or second day, they start getting up out of bed and mobilizing, and this leads to lesser number of other complications, like it may
Correct.
be blood clot in the legs, and whether it is pneumonia is because of lying down. These sort of problems will be less. So robotic surgery is something which can be considered for colorectal cancer. Of course, on a case-to-case basis, I must say that maybe certain types of cases and certain types of patients may not be suitable for robotic surgery. But if your treating doctor feels that it is suitable and this thing, there are benefits to be had because of robotic surgery. So that is to answer the first question. Now, regarding the
Yeah.
second question regarding this one IBD, this one again, this one certain types of inflammatory diseases like ulcerative colitis is known to increase the chances of cancer. But just irritable bowel syndrome or IBS, if he means, that is sometimes the symptoms mimic that of cancer, but per se, this is not known to increase the risk of cancer per se. So, if he has been very clearly diagnosed and there is no this one, just irritable bowel syndrome doesn't increase the risk of cancer, but he should be under the supervision of a gastroenterologist to see. Sometimes there can be overlapping symptoms. So he needs to be under supervision and constant care to check for the symptoms of cancer.
Wonderful, sir. Thank you. And I think we have Anchal here who's joining us on the show. Hi, Anchal. Welcome to the show.
Thank you so much, Jhansi.
Thank
I'm sorry,
you.
I'm
Uh, That's fine. We understand. But it's so good to see you here. We are proud of what you have done and how you have given cancer, shown the cancer a way out. And what you're doing is so wonderful. You are feeding underprivileged children with meals of happiness. And this is joy of living, such wonderful life. It's so good to see you, Anchal. So
thank
quickly, I know you must have talked about this so much, but every talk motivates somebody else. Tell us how important it is to be strong while beating cancer.
See, I always say one thing, your brain plays a very important game, right? हम हमेशा क्या करते हैं? We are victim of our own thoughts. So we are scared of something which is unaware of, right? And we always, visualizing something which is not going to happen with us. Like we just finished the rally, जहाँ पे अभी हम लोगों ने 100 bikers ने आगे आके इस चीज को address किया है. So that's why I got late. And trust me, what I understand, we are lacking of education, we are lacking of knowledge, and we are scared of cancer with the name of cancer, not with the cancer but with the name of cancer. हम लोग वहीं पे अपनी फाइट को आधा कर देते हैं. So my thing is that don't get scared of cancer. If you start your treatment and diagnosis as early as possible, you can live after that treatment good and healthy life as like any normal person.
Wonderful, Anjit. So while Dr. Anil Kamath was saying earlier, Dr. Kamath, आपने म्यूट किया है शायद. Dr. Anil Kamath was saying कि जो आप डॉक्टर की बात सही सुनते हो, and Dr. कुमार ऋषिकेश was also saying the same thing कि ट्रीटमेंट का जो प्रोटोकॉल है वो बहुत ही महत्वपूर्ण है. उसको आप खुद के there are so many factors which influence a person. So
Yeah.
how important was the connection between your treating doctor, you, and your caregivers?
See, it's very, very important, Jhansi. It's a beautiful question. And I always see as a team, like doctors, caregiver, and cancer survivor, right? As I just mentioned, we are scared of name. And we don't know that how strong we are to fight with this disease. But we get scared way before कि हाँ भाई हमें कैंसर हो गया अब तो लाइफ खत्म हो गई है टाइप्स हमारा माइंडसेट वैसा चलता है राइट बट here I personally believe because I have helped more than 1,000 cancer patients till now, one-on-one counseling I'm talking about. Trust me, when doctor says something, and when cancer survivor says something, and the caregiver, there's a huge difference. So doctors are nowadays taking initiative to take cancer survivors on board for these kind of conversation and talks, which is a great initiative, because I believe when survivors say something, so they have this mindset, she deal with chemo, she or he deal with radiation, or he knows, because then they don't have any other excuse to say आपको मेरा पेन क्या पता, आप तो डॉक्टर है, आपको मेरा क्या पेन क्या पता, आप तो केयर गिवर है. तो वो जो क्वेश्चंस है ना, वो वहां पे खत्म हो जाते हैं. So that's why I
Yeah.
believe this kind of doctor, caregiver, and survivor is very strong. It sent very strong message in society, in fact.
Wonderful. So, Dr. Kamath, you was talking about the importance of continuing treatment. So, when
Yes.
you talk to patients after, and also as a medical oncologist, Dr. Kumar Rishikesh should also be able to give us the difficulties of going through the treatment of cancer. Surgical help के बारे में आप पहले बता दीजिए, उसके बाद में हम कीमो के बारे में बात करेंगे. Dr. Anil, you
Yeah,
can go first.
see, whenever I talk of surgery, Ms. Anchal is absolutely right. As a doctor, we tend to focus too much on the treatment part and the outcome part. Patients may be bothered about so many things apart from this, and certain questions they may not even feel very comfortable asking the doctor, like their relationship with their children or husband. How is it going to change after cancer? These questions, we as a doctor, I cannot answer these questions. The financial implications to the this one and the family. Again, these questions a doctor can do very little about it. And there,
Yeah.
if they can discuss with other patients who have gone through the same this thing, they'll be in a much better position to face this one. Now, coming to when I advise surgery, say for any cancer, the first thing which comes into their mind is, will I be able to lead the same sort of life that I have been leading going forward after undergoing the surgery? This is the primary thing which comes into their head. And
सर,
to a
हम
certain,
लोग सर, हम भारतीय जो है, आई थिंक वी होल्ड अ रियल डिफिकल्टी ऑफ प्रोसेसिंग द वर्ड सर्जरी. छोटे से छोटे,
yes,
आप कैंसर सर्जरी के बारे में बात करो जो डबल धमाका है, बट छोटे से
yes.
छोटे सर्जरी के लिए हम लोग डर जाते हैं.
Yeah, absolutely. This one. And the cancer surgery is something where we are talking of removing an organ, say like
करेक्ट.
a breast or a certain this one. So we are
यूट्रस
talking about,
और
yes. So the patient has to process this, and I always emphasize them. What will their life after surgery be? If it is not a morbid surgery, I tell them you will be able to, whatever you are doing today, you will be able to do even after you undergo the surgery. So I make it a point to stress them on their quality of life after surgery. But in certain situations, this might not be the case. In certain patients have to undergo the entire removal of the rectum and they have to wear a bag. So his life is not going to be the same after the surgery. Here we have to emphasize, though you may have to make certain changes to
चेंज.
your lifestyle, it's not the end of it. There are many patients surviving even with this. And most of the things which you are able to do now, you will be able to do even after this one with some modification in your lifestyle. So that is the point I try to stress when I talk about surgery with the
Yes.
patients.
Dr. Kumar Rishikesh, I think it's the same thing. इतने सारे अफवाहें हैं when we talk about chemo and medication with cancer. For example, जासिम शेख जी यहाँ एक क्वेश्चन डाले हैं YouTube पर कि breast cancer के chemo after, even after having the surgery part remove करने के बाद भी chemo की जरूरत है क्या? So chemo से डरते हैं, and not in all cases that medication is advised. So your take on the fear of chemotherapy.
ये बहुत अच्छा प्रश्न है. सो इम्पॉर्टेंट बात समझने की ये है कि कीमो की ज़रूरत होती क्यों है, पहली बात. तो हम समझते हैं कि सर्जरी जो है वो इम्पॉर्टेंट स्टेप है क्यूरेटिव ट्रीटमेंट के लिए किसी भी कैंसर में, एक्सेप्ट द ब्लड कैंसर और सर्टेन मोर कैंसर्स. तो सर्जरी का बहुत इम्पॉर्टेंट रोल है, क्योंकि आप एक लार्ज बल्क ऑफ द डिजीज़ को बॉडी से हटा देते हैं. उसके बाद रोल आता है कि क्या इसके कुछ अंश, क्योंकि कैंसर एक तरह से सिस्टमिक डिजीज़ है, मतलब दिखता एक जगह जरूर है बट उसके सिपाही हर जगह आपके बॉडी में कुछ ना कुछ कर रहे होते हैं. जैसे आजकल के रिसेंट रिसर्च है सर्कुलेटिंग ट्यूमर डीएनए. सो इफ ए पर्सन हैज प्रेजेंटेड विथ अ ब्रेस्ट कैंसर, इफ यू test for DNA related to the breast cancer in the blood. So you would find that there is a load of DNA into the blood also. And gradually that information would be used in future for early detection of cancer also. So कहने का मतलब यह है कि ब्रेस्ट कैंसर वहाँ है जहाँ से सर्जरी कर दी गई है, लेकिन उसके अंश शरीर में और भी हैं. तो कीमोथेरेपी का ये रोल है कि बाकी छोटे बच्चे और जो माइन्यूट एविडेंस है कैंसर के, जो उसके अंश रह गए हैं, उसको हटाना. उसका फायदा ये होता है कि ओवर द इयर्स चांस ऑफ रेकरेंस काफ़ी घट जाता है. बट कीमोथेरेपी हर एक स्टेज में ज़रूरत नहीं है. सो ये साइंटिफिक रिसर्च ओवर द इयर्स ने प्रूव किया है कि किस कंडीशन में, किस स्टेज में, किस टाइप के कैंसर में कीमो की ज़रूरत है और किस तरह की कीमो की ज़रूरत है. सो दिस इज़ नॉट माई जस्ट प्रायोरिटी और माई विल कि मैं ये कीमो दे दूँ. दिस इज़ based on the large clinical trial which has been done and being done across the world, multiple centers, thousands of patients. उसके रिजल्ट को फिर कई सालों तक देखा जाता है, तब हम आपको रिकमेंड करते हैं. फिर उसके लिए गाइडलाइन बनती है, अमेरिकन गाइडलाइन है, यूरोपियन गाइडलाइन है, हमारे गवर्नमेंट, हमारे इंडिया में भी गाइडलाइंस हैं. सो इस तरह से हम आपको एक रिकमेंडेशन अपने एक्सपीरियंस, गाइडलाइन और ट्रायल के बेसिस पर मिला के देते हैं. फिर उसमें बात आती है कि जिस पेशेंट को हम ट्रीटमेंट रिकमेंडेशन दे रहे हैं, जैसे 35-year-old विमेन को एडजुवेंट कीमोथेरेपी या सर्जरी के बाद की कीमोथेरेपी की रिकमेंडेशन डिफरेंट होगी 75-year-old वुमेन से. सो दिस इज ऑलवेज द केस. और उसके अलावा आपके पर्सनल सिचुएशन अलग हो सकते हैं. कोई पेशेंट कहता है मुझे हेयर फॉल नहीं कराना, चाहे जो हो जाए, कैंसर से मुझे फर्क नहीं पड़ रहा, बट आई डोंट वांट हेयर फॉल. सो हमें उस समय इस चीज़ को ध्यान में रख के ट्रीटमेंट देनी पड़ती है. सो इम्पॉर्टेंट बात पेशेंट्स के लिए या जो जानकारी चाहते हैं उनके लिए ये समझना है कि एवरी इंडिविजुअल इज डिफरेंट एंड एवरी पर्सन कैंसर इज डिफरेंट. सो आप दूसरे के रिजल्ट के, दूसरे के डायग्नोसिस को, दूसरे के एक्सपीरियंस को 100% अपने पर नहीं उतार सकते हैं. हाँ, कोई अगर ट्रीटमेंट से गुजरा है, आप उसके अनुभव को जरूर सुने, जरूर समझें, बट अपने एक्सपर्ट से जरूर सलाह लें. लोगों की कही हुई बातों आसपास जो खुद जानकार नहीं है इस बारे में, जैसे सबसे बड़ी किंवदंती यही है कि कीमोथेरेपी से दर्द होता है. लगभग 95 to 98% पेशेंट्स में कोई भी इरिटेशन तक वेन्स में नहीं होते हैं. मतलब कुछ नहीं होता है. लाइक ए सैलिन बॉटल, जो ग्लूकोज बॉटल चलती है, आप वैसे ही कीमोथेरेपी लेते हो. कीमोथेरेपी साइड इफेक्ट जो इमीडिएट है वो है एलर्जिक रिएक्शन. कुछ पेशेंट्स में, लगभग 5 to 10% पेशेंट्स में मैक्सिमम हो सकते हैं. बट आजकल के मॉडर्न मेडिसिन में वो भी बहुत कम देखने को मिलते हैं. और आपको डॉक्टर जहाँ कीमोथेरेपी सेंटर पे इलाज कर रहे होते हैं, वो इससे और नर्सिंग टीम काफ़ी एक्सपीरियंस होती है. सो मोस्टली I can assure you that 99.9% cases they will handle it even if the allergic reaction happens. Allergic reaction आपको एक खाने से भी हो सकते हैं. और इसका मतलब ये नहीं कि आप एक खाना छोड़ते हैं, आप उसको रिप्लेस करते हैं, सब्स्टिट्यूट करते हैं किसी दूसरी चीज से. एक बात है. दूसरी चीज मैं जोड़ना चाहूंगा कि कीमोथेरेपी में भी अब एडवांसमेंट हो रहे हैं. जैसे एक सिंपल सी ड्रग लीजिए, पैक्लीटैक्सेल. वो एलर्जिक रिएक्शन इसलिए करती है कि उसके जो वेहिकल है जिस पर मॉलिक्यूल लोड किया जाता है, वो रिएक्शन वो देता है, लेकिन बदनाम बेचारा कीमोथेरेपी का मेन मॉलिक्यूल हो जाता है. तो लेकिन उसका भी हमें अब समाधान ढूंढा है. फार्मास्यूटिकल कंपनी हैव कम अप विद like a drug is bound to a lipid layer, so it does not react, and for that you don't need even dexamethasone, which is commonly used drug for prevention of this kind of reaction. तो काफी इवोल्यूशन हो रहे हैं. अब आप आगे बढ़िए कि इम्यूनोथेरेपी, नए मॉलिक्यूल्स हैं, उसमें जनरली आपको साइड इफेक्ट्स डॉक्यूमेंटेड जरूर हैं, होते भी हैं, बट कंपेयर टू कि हेयर फॉल हो जाता है और काफ़ी चीज़ें होती है, वो सब तो बिल्कुल नगण्य है. तो इवॉल्व हो रहा है साइंस भी. और आप rather than asking somebody who doesn't know anything about the chemotherapy, एक्सपर्ट से पूछें, सही जानकारी लें. इंटरनेट पर भी जो ब्लॉग्स लिखे हैं वो देखें कि लिखने वाले कौन हैं, क्या वो जानकार हैं. क्योंकि मैं ये देखता हूँ कि यूनिवर्सिटी से लिखे हुए ब्लॉग्स को कम पढ़ते हैं. कोई ऐसे जानकार हैं जिनको सही से उस बारे में नहीं पता, उनके ब्लॉग्स को लोग ज़्यादा पढ़ते हैं. तो वो सब क्वेश्चंस को
तो
हम
सेंसेशन चाहिए सर लोगों को. we
तो
we
हमारे
actually
पास
our brains are processing different kind of information each time. But thank you so much for reassuring that we have treatments, both the doctors. Anshul ji, एक question यहाँ मैं आपसे करना चाहती हूँ. While you were going through your treatment, whichever procedure that was advised by your doctor, so let me ask one registered user's question as well, one audience question as well, and then come to your personal experience. Here is, yes, Ram Kumar Agarwal ji पूछते हैं, somebody I know has committed suicide out of depression due to cancer. Was it right to save himself from extreme pain? I think doctors also should come here and answer. What would you like to say to people who are going through a similar experience? Also, I know personally of a very, very close friend's wife. He, while going through the entire treatment of the cancer, didn't want anybody else to know about it. They both, wife and husband, were in such depression. They did not seek help. They did not want anybody to know. जैसे डॉक्टर कुमार ऋषिकेश जी बोल रहा था कि बाल झड़ने नहीं चाहिए, कोई पूछेंगे, बाहर नहीं निकलने चाहिए, दुबले हो गए हो, कोई पूछेंगे. So they had literally locked themselves up. So these are the signs of mental health issues. अंशुल जी, आप क्या कहना चाहेंगे कि ऐसे situations में कैसे, how do you stand tough?
Jhansi, you know what? Thank God you address all these questions here because अभी भी जो मैं करके आई हूँ, right? वो इसी के लिए था because we are always impressed by negative stories. We pick up always negative stories from the जैसे डॉक्टर कुमार ऋषिकेश ने कहा कि हम लोग उनकी रिसर्च पे ज्यादा बिलीव करते हैं जिनको कुछ नहीं पता है rather than the doctors who studies years and years to get proper and actual treatment. So लोगों का बस यही है कि मैं ये कहना चाहती हूँ, एक तो गूगल और पीपल दोनों के एडवाइस से बिल्कुल दूर रहे because these are the most harmful things, right? The second thing, yes, I know many cancer patients जिनकी मैंने खुद ने काउंसलिंग करी है. They tell me especially, Anchal, please किसी को मत बताना. We don't want people to know about that we are going through cancer. I don't know when we change this mindset. And trust me, because of that, because people are not open about the cause and they are pleasing the society. They're not pleasing themselves. अभी ये टाइम आ गया कि अपने लिए जीना कब सीखेंगे आप? आपको कोई प्रॉब्लम है, मुझे कैंसर हुआ, ट्रस्ट मी, झांसी मैंने एक दिन विग पहनी थी थोड़े टाइम के लिए और मेरा कोई 70-80 लोगों का इवेंट था एंड आई स्टार्ट फीलिंग वेरी डिस्कंफर्टेबल. मे बी डॉक्टर अनिल एंड डॉक्टर कुमार ऋषिकेश नो अबाउट दिस, हाउ पेनफुल इज इवन द विग प्रोसीजर व्हेन वी वेयर. इतना टाइट होता है, समर्स में हो तो डिस्कम्फर्ट, पिगमेंटेशन एंड ऑल दैट. मैंने थोड़ी देर मुझे पेन हुआ ना, आई रियलाइज मैं किससे अपने आप को छुपा रही हूँ. Who are these people, right? And I am in so much of pain just to show society कि मैं कितनी अच्छी लग रही हूँ. मैं विदाउट हेयर बहुत बुरी लगूंगी. ट्रस्ट मी, मैंने बिना ये सब सोचे 70-80 लोगों के सामने अपनी वो विग उतारी जिनको ये नहीं पता था that she is dealing with cancer. And I was in so much of ease, so much of relax at that time. I was like, after that, trust me, मैंने कभी wig नहीं पहनी. I changed the trend, and my doctors and everyone is like, Aanchal, this is the best thing you are doing. I start embracing my pain. I never hide my radiation mask. I never hide my chemo pot. And I was dressing like a supermodel, wearing my red lipstick, best makeup. That plays a very important role in recovery. Your mindset actually plays a big role in recovery. So we all have to educate people about the disease, not the embarrassment. And not this people also think कि कैंसर है, किसी को पता चलेगा तो क्या होगा, क्या होगा. वो आपको आके ठीक नहीं करेगा, वो आपको आके ज्यादा बीमार नहीं करेगा, right? So
जी,
I
जी.
think, God, you are so strong to deal with cancer, then why you show your weaker side to the society, that society is taking toll on you कि आप उसको नहीं बता सकते कि कितने strong आप हो. So
Yes,
I
yes.
believe कि हमें अपने आप को हाइड नहीं करना चाहिए. प्लीज इनफैक्ट कम फॉरवर्ड एंड टॉक अबाउट such a issues in society so that we can spread more awareness. And I'll tell you one more thing here, Jhansi. Yesterday, I run one event program yesterday where red lipstick I show as a misal, right? I know many cancer patients. Trust me, they never shown their without hair picture to anyone. But yesterday, almost 100 females come forward with that red lipstick, no hair, and they post that picture on their social handle. That's the strength of education and openness.
More strength and more power to you, Anchal. It's wonderful having you here, and keep spreading the good work and give good word, and keep spreading the happiness, joy through all of us. The wonderful NGO work that you do. Thank you, Anchal. So let me continue with the doctors. Dr. Anil Kamath ji, यहाँ पर a lot of people are asking about multiple cancers. So colorectal cancer के बारे में ज़्यादा लोग पूछ रहे हैं. Is this something which is catching up, and what are the treatment options available for colorectal cancer?
Yeah, colorectal cancer is certainly one of the cancers which is on India. So definitely people need to be aware about it. So usually it presents in different ways, but the usual way, if there is blood in stools or visible blood, or sometimes we detect after testing, or there is unexplained weight loss. This is the way we commonly detect colon cancer. Some patients present with obstruction. They find some holdup of food after taking. They find that their abdomen gets bloated up. Now, diagnosis is usually by a colonoscopy. So the tube is inserted through the rectum and biopsies are taken. And the staging is done usually by a CT scan or a PET scan. Coming to the
Yeah.
treatment options, colon cancer, we divide this into colon cancer and rectal cancer, because colon cancer, the primary treatment is surgery. We do a procedure what is known as a radical colectomy, removing a significant part and joining the two ends. So surgery is the treatment of colon cancer, and there is a surgery depending on the stage. We might advise chemotherapy. Rectal cancer is a little different from colon cancer in that, especially if it is of a little higher stage, there is a strong indication to use chemotherapy and radiation prior to the surgery. Surgery plays an important role, but surgery in rectal cancer beyond a particular stage is usually treated with chemotherapy and radiation first, followed by surgery. So this is
Yeah.
colon and rectal cancers are treatments which require multimodality treatment, and there has to be close cooperation between the surgeon, the medical oncologist, and the radiation oncologist. When it comes to advanced cancers, those which have already spread, the main treatment would be chemotherapy. This is the broad overview of treatment for colon and rectal cancers.
Alright. Dr. Kumar, यहाँ पर मुझे एक और बात पूछनी है. While we see a rise on the colon and rectal cancers, हमारे lifestyle में ऐसे क्या चीजें आए हैं, जो changes आए हैं, जो which are increasing these, other than the familial and genetic issues?
देखिए इसमें थोड़ी इम्पोर्टेंट बात समझने की है कि इंडिया इज़ अ बिग कंट्री. सो जोग्राफिक इंडिया के विद इन इंडिया द जोग्राफिकल रीजन्स में डिफरेंट कैंसर्स ज़्यादा प्रोमिनेंट हैं. सो लाइक इफ यू लुक एट द गैंगेटिक बेल्ट, द गंगा के किनारे वाला एरिया, वहाँ गॉल ब्लैडर कैंसर बहुत कॉमन है. सो
जी,
आप नॉर्दर्न इंडिया में
गल ब्लैडर कैंसर के बारे में पूछे हैं. We can also touch upon that. Yes.
तो उसी तरह से साउदर्न पार्ट ऑफ द इंडिया में जो जीआई कैंसर्स हैं, स्पेशली द एसोफेजियल स्टमक एंड कॉलन कैंसर ज़्यादा प्रेवलेंट है. स्टडीज बहुत कंफर्म नहीं कर पाई इस बात को, बट सम सजेस्टिंग दैट मे बी द मोर यूज ऑफ स्पाइसेस हैव कंट्रीब्यूशन, दो वी अंडरस्टैंड साइंटिफिकली कि इसमें जेनेटिक हिस्ट्री और ये सब का रोल बहुत इंपॉर्टेंट है. सो वी आर नॉट एट दैट पॉइंट वे कैन टेल यू कैटेगरिकली या क्या एग्जैक्टली क्या रीजंस हैं, बट डेफिनेटली डिस्ट्रीब्यूशंस अलग अलग हैं कैंसर्स के डिफरेंट पार्ट्स में. बट जो राइज है उसमें डेफिनेटली हम एक चीज़ और समझने की बात है कि हम, जैसे डॉक्टर साहब ने पहले ही, डॉक्टर कामत ने पहले ही पॉइंट आउट किया, उसमें एक चीज़ और इम्पॉर्टेंट है जोड़ना कि इंडिया का पॉपुलेशन भी बहुत बढ़ चुका है और उस हिसाब से हमें केस लोड ज़्यादा हैं. सो दैट इज़ ऑल्सो वन ऑफ द इम्पॉर्टेंट थिंग, बिकॉज अब पहले शहर छोटे थे, अब बड़े हैं, पॉपुलेशन ज़्यादा है, हमें नंबर ज़्यादा मिलते हैं, हेल्थ सेंटर्स उस हिसाब से नहीं बढ़े हैं. सो ये बात समझने की इम्पॉर्टेंट है. सो ओवरऑल जो तीसरी बात है वो ऑफकोर्स हम मोर केसेस डायग्नोज कर पा रहे हैं. जैसे मैं अपने ही एक नोन से बात पूछ रहा था, उन्होंने कहा कि एब्डोमेन में कुछ हुआ था, पता नहीं, लेकिन उनका डेथ हो गया था. सो ही वॉज नॉट श्योर कि वेदर इट वॉज कैंसर और नॉट, बट मैं हिस्ट्री जब लिया तो मुझे लगा शायद उनको कैंसर रहा था. सो राइज अपने आप में our sedentary lifestyle जो colon cancer के लिए बहुत important risk factor है. बहुत
Absolutely.
number one अगर very important risk factors. Of course the family history या genetic mutations ये सब हैं, but sedentary lifestyle, our dietary habits, all those things have to lot of to do with that. And screening is maybe important है. At least we can detect it at earlier stage. एंड आपको समझ जान के आश्चर्य होगा कि कोलन कैंसर को जनरली डेवलप होने में 10 साल से ज़्यादा लगते हैं. तो एक लंबी हिस्ट्री है जहां आप कैच कर सकते हैं पॉलिप को, जो कि फिर वही पॉलिप कैंसर में कन्वर्ट होता है. बट ऑफ कोर्स हमारे कंट्री में पॉपुलेशन बेस्ड स्क्रीनिंग प्रोग्राम नहीं है बिकॉज वी आर बिकॉज ऑफ
Correct,
फाइनेंशियल
correct.
कंस्ट्रेंट्स ऑफ कोर्स. तो पॉपुलेशन बेस्ड स्क्रीनिंग प्रोग्राम होते तो हम ज़्यादा कैंसर्स को डिटेक्ट कर सकते थे और ट्रीट कर सकते थे. अभी एक रिसेंट रिपोर्ट आई है यूनाइटेड स्टेट्स से, एंड आपको ये जानकर आश्चर्य होगा कि पिछले 15-20 साल की जो स्टडी है उसमें यूएस में जो सर्वाइवल है वो 33% इम्प्रूव हुआ है कैंसर से. So that is a big achievement for them. And of course we understand that the diagnosis, early detection, prevention इसका role बहुत important है rather than treatment, what we feel as an
Yeah.
oncologist.
Yeah, quickly, Anchal, would you want to comment on the kind of food or the lifestyle changes that you've made and how importantly you shifted your mindset to have good food?
Yes, that is the key point here because I believe that cancer is more of lifestyle disease, and I think both the doctors will be agree with me because nowadays we are eating everything which contains chemical, right? And our lifestyle is changed so much. We are more on phones than the roads. People are not exercise. People are doing indoor exercises. So वो जो एक basic nowadays, you know what, basic is the best I consider. So I completely changed my lifestyle. I'm doing yoga. I am physically super active throughout the day. And then I try to eat clean and simple food. That plays a very important role because gut जो है वो सारी प्रॉब्लम स्टार्ट ही गट से होती है राइट इफ योर गट इज ओके you are 90% living a healthy life. And second thing, people don't do exercise and people don't sleep properly. Sleeping is also very important for the recovery or for any human being who's going through lots of stress, even cancer. It helps to recover. So we just need to implement simple things in our life. We just need to adopt simple things in our life, and trust me, you will see the amazing change. But we know
Great.
everything, but we don't want to implement in our life, you know.
वही तो बड़ा प्रॉब्लम है अंशल, सबसे बड़ा प्रॉब्लम वही है. So next question to Dr. Anil Kamath. Anu is asking this question: if the cancer cells have been killed by radiation and chemotherapy, why do they even come back? Why is it relapsing? Is there anything more that you doctors can do? So let's talk about
No,
relapse of cancers and recurrence.
yeah, relapse is a part and parcel of, or fear of relapse. I'm not telling that relapse will happen. Fear of relapse is a part and parcel of cancer. And any cancer, whatever stage we tell, even if we say stage 1 breast cancer, we tell 95% cure rate. We never tell 100% because a small fraction does relapse. Now the question, why does relapse happen? Dr. Rishikesh was talking of cells in the blood. So always there is what is called visible disease and what is invisible disease. Certain cells escape the primary organ and they'll be found in the blood. And because of this, this one chemotherapy is given even after surgery is done, precisely to tackle these cells which have escaped the primary organ. And even when we tell chemotherapy, it works on certain types of cells, whereas certain other cells, which are in different phases of the cell cycle, they may develop resistance to the chemotherapy and they may be dormant, just like the sleeper cells or something. And when even after the primary tumor is treated, these sleeper cells become, and that is why recurrence happens. Even when we tell radiation, radiation does affect, it kills majority of the cells, say 90-95% of the cells, but the dormant cells after certain time can become active and this can lead on to become cancer.
Okay, okay. Dr. Kumar, here's a question about immunotherapy. Shazi is asking, how much is immunotherapy preferable over chemotherapy? What's immunotherapy, sir? Quick understanding of it, please.
Okay, Kajal, thanks for this question. The important thing, and especially in today's world, is important to understand what immunotherapy is, and I would point it out like this manner, that our cancers, when it is going, when it is, I mean, forming in your body, it has interaction with the immune system of our body. So our immune defense starts working against it. However, it fails, and that's why it cannot eradicate from our body. So then,
Right.
scientific community has developed a molecule which can induce our immune cells, I mean, to kill the cancer cells effectively. What happens actually, if you go back, that cancer cell has the capacity to kill your immune cells. And what we are doing, that we are giving a block in between and not allowing the cancer cell kill our immune cell. Rather, we are super activating our immune cells to kill the cancer cells. So immunotherapy is a method, a treatment in which we activate your own immune cells to kill the cancer cells. However, I would say, despite years of research, we have not reached to the stage where chemotherapy is completely out of the picture, and immunotherapy has taken every role. So, at this point of time, we are mixing chemotherapy with the immunotherapy in most of the treatment, and immunotherapy is mostly given in stage 4 or advanced cancers to prolong or control the disease and prolong your life. So still immunotherapy is not in a phase where we are using it in curative setting, except 2 3 examples, like one in the breast cancer where we are using it in that manner, like early cancers and locally advanced disease also we are using immunotherapy. So this is very effective molecule so far. It has shown its result, and gradually over the years we would see that maybe it will take a center stage.
Wonderful. Dr. Anil, here's a very interesting और funny question. कोई पूछते हैं कि स्मोकिंग के लिए ऐसा डिटॉक्स मेडिसिन जो है जो कैंसर को दूर रखे. Do you think there's any Pamir is asking this question?
No, there is no simple this one. Smoking is an important contributor for most of the cancers: oral cancer, esophageal cancer, bladder cancer, stomach cancer. Now, for us doctors, it's easy. We always tell quit smoking, but we realize the troubles of the smoking, because quitting on their own usually does not happen. And most of the patients I have seen who this one, usually they relapse, they start smoking again. This is because they are dependent, and if they don't smoke, they feel their performance comes down. Their body doesn't function optimally when they don't smoke. A certain number of patients are able to quit on their own, but quite a majority of them do require professional help, and it is not by, it's usually by addiction specialists or psychiatrists who do this. A certain number of patients, there are various techniques, which is not my specialty, but there are various techniques in which they can reduce their dependence on smoking and tobacco. A certain substitutes are available now. Those who have got withdrawal symptoms from tobacco or this thing, like we have chewing gums, nicotine chewing gums, and certain other things, which can reduce their or slowly their body can be weaned off this one. So try on your own, but do not hesitate to seek professional help of a de-addiction specialist if you are unable to quit smoking.
Yes, one known reason that we can avoid, let's avoid that. One cancer के लिए अगर vaccine है तो let's get that. Let's spread the awareness, as Anchal is on a mission to spread awareness. Thank you, Anchal, for being on the show today, and time for us to conclude the show. Before I take leave from you all, Dr. Kumar Rishikesh ji, I would want you to quickly update. Okay, Vincent is asking, after completion of chemotherapy, monoclonal therapy, is PET scan necessary? And if necessary, what duration do I have to repeat? One last question before we go.
Uh, yes, even if we are treating you with the monoclonal antibody, we need to monitor the tumor burden, whether it is responding to the treatment or not. In most of the disease, we do the scanning every 3 months. And one thing I would like to point out, that it is not always necessary to do the PET scan only. I mean, we people understand that if there is cancer, PET scan is necessary. It is not. So PET scan is only approved in certain cancers where it has shown the better outcome if you are treating the patient with the help, with the use of PET scan. But It is not mandatory. So in the chemotherapy or immunotherapy, it is not mandatory. However, if it is being done, it should be done mostly 3 monthly.
All right. Dr. Anil ji, एक last question आपके लिए भी. I didn't want to let go of this opportunity. Mr. Vijay Kumar is asking, cancer of ovarian recurrent patient removed both ovaries and uterus 2 years back, undergoing fourth line of chemotherapy. What options are left for us for further treatment?
Yeah, actually this question would be better answered by Dr. Kumar.
All
Usually
right. Yes.
the option is going to be chemotherapy only. If she has reached the fourth line treatment, I can assure you very small role for surgical resection. Though in certain ovarian cancers, after relapse, we have gone ahead and resected the tumor. But if it has reached the stage of fourth line, I think Dr. Rishikesh will have to see what the first 3 lines were. And then there are options now to look at the next line of chemotherapy.
Great. Dr. Kumar, would you want to add on to the?
I would just like to add that I hope the patient has undergone mutation testing, and doctor might have gone through that, whether
Oh
she
yes,
was fit for the.
BRCA is negative.
Okay, then there's one test because I understand that some physician is already involved, but I hope the HRD testing might have been done. Though now in the fourth line, so after I mean fourth line onwards, the test like newer medicines like targeted treatment is not that very great for the treatment. So overall, looking at the whole picture, I can tell the patient that what would be the best suitable care at this point of time. And through oncologist, the treating physician, I think it would be better to be answered.
All right, sir. Thank you so much once again. And before we leave, let's stop. Yes,
John,
please go
I
ahead.
just want to say one thing. We see lots of females or males, anyone who's going through cancer, they are doing the big mistake, which I meet one-on-one cancer patients and I got to know. So, they're always, आज की डेट में बहुत कुछ ये हो रहा है कि I'm sorry, I'm not disrespecting anyone, but people are, I think all the doctors will agree with me, every cancer and every body is different, right, sir? There are lots of lumps which are not cancerous, but they disappear after some time, right? And because of 90% of that ratio, major audience, they are like जो ऐसे सब फॉलो करते हैं. इनफैक्ट मुझे भी हुआ था कि बाबा जी के पास जाओ, आप वहाँ पे खाना खाओगे, आपका लंप ठीक हो जाएगा. बट विच लंप इज मेंट टू बी डिसअपेयर, इट मेंट टू बी डिसअपेयर, राइट? which is like, and maximum female body में जो lumps होते हैं, they are meant to be disappear, they're fibroid and some other lumps, right? But we are
Yeah.
like impressed with that because it is not canceric any which way, so it will disappear. But the person who are genuinely dealing with cancer, they also start following that pattern, and that because of that pattern and because of that belief कि उसका लम चला गया, उसका साथ ऐसा हो गया, those 5% people actually lead to initial stage to the advanced stage of cancer. So I request, whenever you found something which is suspicious in your body, please go to the doctor, not to Baba, and not to any other alternative.
All right. Thank you so much, Anchal there. Dr. Kumar Rishikesh, quickly, top tips from you. How do we deal with cancer and what are the best ways to beat it?
Yes, so my advice is please understand that prevention is better than cure. So if there is a screening methodology, if there is a early detection, please follow that. Second thing is sedentary lifestyle is bad. Third thing is cancer treatment is evolving. Please explore, please contact experts. Do not rely on hearsay or anecdotes. Thank you very much.
Doctor, very simply put, but very effective tips there. Dr. Anil Kamath, the call for this year's cancer awareness is closing the care gap. So, would you want to give us some tips on that?
Yes, see, when we tell closing the care gap, that means we should be able to provide the same quality of care even at the lowest common denominator, a person who cannot afford or this thing. This is difficult because this is something, this responsibility comes from the government. But if you have been diagnosed a cancer, discuss with your doctor regarding the various options available. There might be cheaper options which will give you the same results. And cancer is always a teamwork. So discuss with not just the surgeon, the medical and the radiation regarding what the best line of treatment will be. So this automatically will bridge the gap of treatment, and the patient will receive the best possible care for his particular disease.
Once again for joining us. It is a
I
great
have one
session.
point
Thank
to
you.
add
Yes, Dr. Kumar, please go ahead.
quickly. So, I mean, at Indraprastha Apollo Hospital, I mean, because of the facilities available and the government relief program, those who cannot afford simple chemotherapy also, we have arranged from the government funding, because if the patient is below poverty line, we arrange fund, and we assure that nobody should remain without treatment. Everybody has the, I mean, right to get treatment for what I understand, and that's why I try to arrange fund. And I think the cancer community, stakeholders, doctors should strive for arranging the fund. We should work in that line also. And those who are poor, those who cannot afford, we should help them. And please understand, the immunotherapy and other fancy drugs are not always beneficial. Sometimes you don't need it. So don't strive for those things which are not going to help you. So meet the experts, do only which is necessary. That's all. Thank
Wow,
you.
not every medical professional has that hard to say, but thank you so much, Dr. Kumar Rishikesh, Dr. Anil Kamath, and Ms. Anjal Sharma. It was a wonderful discussion. Thank you, sir. Namaskar.
Thank you.
Thank you.
Have a nice day.
Thank you. So this was today's live session, and now I continue to go ahead with health quiz. Here are our questions. Please answer your questions over YouTube chat only. Winner's name will be announced at the end of the show, and the winners will be selected at the sole discretion of Apollo 24/7. And winners to mail their contact details at marketing@apollo247.com. Gift vouchers will be shared with you. And regarding the pending last week's health credits, I think they have been credited. In case that you still do not find the health credits which were given away, please do contact us back. They'll be shared shortly with you. चलिए तो आज के 3 questions आपके screen पर डाल लेते हैं. Please do answer on YouTube. The question number 1 is true or false? Getting a biopsy makes a cancer spread. Is that true or false? Question number 2, fill in the blank. Cancer tumors can be divided into 3 groups: benign, dash, or precancerous. What is that? Dash. So it starts with M, okay? Question number 3, yes or no में आंसर दीजिए. Is cancer contagious? एक दूसरे को लगता है, एक आदमी से दूसरे आदमी को लगता है क्या कैंसर? Yes or no में आंसर दीजिए. These are your 3 questions. Thank you so much for joining us. Do join in the next week's session as well. And before we close, here are the gift coupons which we give away every week. So the first coupon that we are giving away is code AskDoc150, ASKDOC 150. Use this on Apollo 24/7 to consult top doctors, and you get up to 150 rupees cash back on online doctor consultation. And the next coupon that we are giving away today is FIRST3, FIRST3, code FIRST3. You order medicines direct from Apollo on Apollo 24/7, and you get up to 25% off on online medicine orders. This is valid on orders above 1,000 rupees for the first 3 orders. And you can also get up to 2-hour delivery as well. And HH247 is our next code. This is exclusive to our Health Hour viewers. Get up to 199 off on online consultations with Apollo doctors, and also 20% off on medicine orders. You can use this on Apollo 24/7. And in case that you don't want to use the app, and the convenience of WhatsApp is always there, you can text us or just call us. You could do Apollo 24/7. You can save this number and WhatsApp 09355247247 to avail all other healthcare services. So I'm waiting for our winners for today. So let's see, a lot of them: Roma Harminder, Bhanu Prakash, Raksha Kashmir, Indo-German. All of you have been answering, and I'm waiting for the winners to be selected by my team. And before we close, I would want to understand that a lot of people join us regularly. Thank you for joining us regularly. I know you are looking for answers, and your active engagement, your questions make a lot of difference. So please do like this session or any other sessions that you have liked. Go ahead. If you like it genuinely, please give us a like and thumbs up. And also, if you subscribe this channel, you will never miss an interesting debate or a discussion. Every week we come back with an expert. So go ahead and subscribe so that you will not miss any of the sessions that we are going to do. By the way, next week हम लोग बात करने वाले हैं. We are going to talk about how to prevent and reverse fatty liver disease. non-alcoholic ho ya alcoholic ho, let's understand what fatty liver disease is and how is our liver struggling and how do we prevent and reverse fatty liver disease. We'll be joined by our experts from Apollo Hospitals, and you can ask all your questions or you can also register your questions. So I am still waiting for to conclude the session. I'm waiting for my winners to come, my winners list, requesting my team to please go ahead and select the winners so that we can announce and close the session today. All right, the winners are here: Lavanya CNM, Subro Nyogi, and Bhanu Prakash. Congratulations. Please do write back to us at marketing at apollo247.com. And last week winners, your health credits have already been given. Please go ahead and check. If not, please revert back to us. Thank you all of you for joining us on this Sunday morning. Next Sunday milte hai. Namaskar.